I'll start the meeting. I like being prompt. Could I call for nominations for chairman of this subcommittee, please? Councillor Geddes.
Thanks, Claire. Councillor, I would move Councillor Jim McClung as nominated as chairman of the subcommittee.
There's no other nominations. Councillor McClung, would you like to take the chair, please?
Thanks, College, for my nomination as Chair of the House and Sub. I would like to remind everyone present that the meeting is being recorded and it will subsequently be available for public listening. Could I have Sederunt and Apologies, please?
Apologies from Councillors Collins and Mail, Chairman. There's 9 members present.
Is there any declarations of interest? So no, move on to item 4. It's a progress report on the Common Housing Registrar.
Thanks, Chair. The report in front of members. There's no further information to add. Happy to take any questions, Chair. Thank you.
Councillor Lever.
Well, I know there's different reasons behind the delay this time, but it is very disappointing that this has been going on for about 10 years, I think. Thereabouts. I seem to remember about 2003, there were 2 full-time members of staff appointed to drive this forward. And I mean, part of the reason why we asked this to be a regular item on the agenda was because we were concerned about slippage in this coming forward. I mean, it is a very important thing for tenants of the RSLs that we do get this up and running as quickly as possible. So I appreciate the reasons behind it, but I just want to express the disappointment that it's happened yet again. We're getting further slippage in this. And I hope this is going to be the last time we are told that this isn't running to timetable.
Thanks, Chair. Yeah, fully accept members' disappointment. And one of the key things that we're trying to do strategically, leading the project group, is to drive forward the project, and well aware of the benefits it will bring to the households across the region. In terms of the current project, I think it is fair to say that it's been on the agenda for 10 years plus, because it was referenced in the first local housing strategy. But in terms of this specific project, it's really kind of kicked on since January of last year, when we got the additional funding agreed and the project plan, and we got all the RSLs signed up to both the concept of a common housing register and a common allocations policy. So in terms of the current iteration, if you like, the current project is kind of almost 2 years in, which it's not an excuse. It's still relatively quick compared to how other CHRs have been developed across the country. But we're conscious how keen members are to see this up and running. We keep pressure on, and obviously we'll keep providing an update. The current position is because the Orchard software development process is critical in the kind of sequential development of the system. We're at a bit of a kind of impasse, because we can't finalise the policy and test it properly through the system until the system is built properly. So it's this kind of chicken and egg situation. Orchard have been pushed by DGHP, who are the contractors, who are the clients in this situation. And I know their Director of Finance intervened specifically with Orchard to push them on, because the initial date was into next year that they gave. So they've managed to pull it back to December. So everyone's aware, all the partners are equally aware that we need to push on and try and get it concluded. We're doing our absolute best to make sure that we deliver on that. We've got regular meetings pretty much on a fortnightly basis. We're meeting with the steering group. There's another meeting scheduled tomorrow, and we keep that pressure on to try and get it delivered. And we'll keep members advised of progress. Thanks, Chair.
Councillor Foster.
Thank you, Chair. Firstly, it would be remiss of me if I didn't congratulate you on your lofty appointment, so congratulations. It's 3.23, a single specialist occupational therapist. who's going to be based out of DGHP by the sound of things, is going to be in charge of all this. Will one person be able to do that, bearing in mind that a person may be waiting for a house, their medical condition may deteriorate, it may improve, it fluctuates all the time, it's not an exact science, medical points, they can go up and down. And bearing in mind the number of properties that Lower Burn, DGHP, all the RSLs have, will one person be able to do that job?
Thanks, Chair. When we developed the proposal to have this dedicated CHR occupational therapist, we did look at the potential workloads and implications. All the partners feel that it's sustainable in terms of the number of medical applications that will be assessed. Not every applicant will require a home visit, for example. There'll be some filtering from the OT specialist based on the kind of assessment forms that individual households will complete. She will have access to other information. She'll work closely with the council-based OT service and the council social work services. So we're trying to develop this kind of collaborative approach, and we think it will work. If we find through an early evaluation that the workload is too much for a single OT, then obviously we'll look at what possibilities we've got to address that capacity issue. But at the minute, that's the way that we're taking it forward. And just out of interest, members might be interested to hear that there was some discussions with Scottish Government officials from DGHP and the newly appointed OT, and to advise them what we're doing down here. And they think it's the first arrangement in Scotland where we've got an OT based in the RSLs with this specific brief. So they're keen to see how it works out, and they were quite positive and impressed about the way that we were trying to work collaboratively across the sector. So it could be seen as potentially a kind of cutting-edge approach to dealing with medical assessment through the CHR. Fingers crossed it works out, but so far we think it will work, and we think there will be capacity to deal with all the applications.
Councillor Crothers.
Thanks, Chairman. I mean, it is good to see this here, and I think there's been some reservations put forward, and I think it's fair enough they are put forward. But I think in the last 2 years there's been a tremendous amount of work done by the Housing Department as we go forward. Just in the frequency, I mean, the frequency of these reports coming to us, I think is important. We have seen as many as these, but say come December, this is it's all in place. The IT goes forward. They'll need a period of bedding in time where it'll have to be implemented. Then it'll go live or whatever that scenario, how it pans out. At what point will we then we will back off as a committee to look at this? Just if you can outline the dates, what we think we will be in the future, how it will be implied, and at what point will we look at it maybe every 6 months to see, because I think it's so important to see once it's in the real effect it has across Dumfries and Galloway.
Thanks, Chair. In terms of monitoring arrangements, obviously the Housing Subcommittee need to decide how frequently and closely you wish to monitor its implementation, and we'll produce a report closer to the go-live date to give you options about that. I would suggest probably in the early stages of the CHR, maybe a kind of 6 monthly update for the first year or two would be appropriate. That gives enough time for you to see how it's operating in practice without having to rush to too quick a conclusion about anything. So probably 6 monthly monitoring reports, and then drop into annual reports if we think it's operating effectively. We will continue to be a key funder of this project because Housing Subcommittee committed a revenue support for it. So you've got both the strategic and a financial interest in the project going forward. So I think we will continue to produce monitoring reports. We'll probably scale it down once it's properly bedded in.
Yeah, the idea once it's up and running of an initial 6 monthly and then yearly reports sounds okay with me. But until it's up and running, I would prefer that we get an update until it actually gets up and running. Councillor Dempster.
Thanks, Chair. First question's a daft laddie question. How do we manage things like statutory holidays? I imagine this lady, seems to be a lady, will be entitled to 30 odd days holiday, which is a month. But then if you've got long-term sickness, how do you deal with that? Because you can't have just a single person looking after a complex and very important part of the allocations process without having some mechanism in place to ensure the process is ongoing. And the other thing, and I know it may not be directly related to that OT's role, but 323 early preparation for the rollout of health and social care protocol has been taken forward. Well, given that we know when the go live date is, when we've got a member of staff in place, I thought that had been happening.
Thanks, Chair. In terms of cover, obviously it's an issue about resource. It is only a single post. There will be a protocol in place between the CHR partners and the Council's social work OT service. And this OT, the CHR OT, will actually free up some capacity within the Council's social work service, because they currently, on occasion, are brought in to carry out assessments in terms of housing allocations. So that protocol will need to cover the arrangement that you talk about. So if we've got absences, then we'd need to have a fallback position where social work OT service can cover on a set of criteria. It wouldn't be, I think, operating in parallel. So we wouldn't have the social work OT service working with the CHR OT at all times, doing the same thing, but they'd be able to step in if required, and we need to make sure that that's covered through the protocol. The senior practitioner for the OT service within social work is a member of the CHR steering group, and she's a great supporter of the work that we're doing. So I don't see any difficulty in working that through operationally. So there shouldn't be any big gaps in service. Sorry, what was the second question, Councillor Dempsey?
It was, why are we not having, if it links at all, this reference in 323 about, in addition, early preparation for the rollout of health and social care protocol is being taken forward. Well, it was just a suggestion that maybe it should be being done rather than being taken forward, because we know who the OT person is, we know what we're going to be doing. The only delay is because of an IT issue, not necessarily a personnel issue. I was wondering why it isn't being done as we speak, rather than the protocol being put in place.
Okay, thanks, Chair. Yeah, the protocol is not dependent on the go live date, but what we need to do is work with social work case officers out in the field to make sure that they understand what the new protocol is and how it would work operationally. So that's the process that we're having to go through first, because it will rely heavily on social workers out in the locality teams understanding and working with the protocol. So it's not just a case of us saying the protocol's now in place. There's a kind of leading and training issue for social work services, and that's the phase that we're in at the minute. But we're not holding that back until the go live date. Once we're confident that the training has been rolled out properly, that social work are properly engaged with the protocol, then that can be implemented, and it won't be dependent on the go live date. But we're just going through that process in parallel, if you like.
Councillor Peacock.
Thank you, Chair. And John sort of answered in part the question I was going to bring up, and it's regard the OT in the position. As it is in the report, it states that she's here to deal with all housing applications and undertake the assessments on their behalf. And she's been put in post slightly later than the original date. But with the delay in the go live date and the computer systems now, although it states they're looking for early next year, we don't have a date, and we can't actually define a date for that because we don't know when they're going to be able to manage to sort the system out. Surely that will have an impact on the therapist's work. You know, as it's stated there, she's there to assess the applications that come in, but until we get that system up and running, there will be no applications for her to assess. But I appreciate what you just said earlier on about preparing things and getting that. So it's just a bit of a concern on the delay that it will impact on her actual work.
Thanks, Chair. That is something we discussed through the steering group and how we would manage that. The OT can carry out medical assessments based on the 4 existing allocation policies. So she can actually start work, carrying out medical assessments, and that won't require any change within the RSL's existing policies to do that. They currently have 3 or 4 different ways of assessing medical priority. There's a self-assessment, there's basically housing officers do it for one organisation, another refers to NHS, Smith Bank for an assessment. We can rationalise all that, stop it, and we can start using the CHROT to do that process within the existing policy framework, with the existing 4 policies. So again, we can actually get it to start doing real work without having to wait for the go-live date. And that will help inform the transition from the current arrangements where we've got the multiple policy position to the single policy. And it will give a good kind of lead-in time for the CHROT to get to grips with the new stock and the issues that she'll encounter. So again, we won't be waiting for the go-live date for her to start doing real work.
Yeah, I appreciate that, but even more concerning that the go-live date isn't delayed and delayed and delayed, because that then will have an impact on our workload. So we need to keep an eye on that and keep trying to push that. And I appreciate it's an external company with the IT, but we really need to monitor that situation.
One of my reasons for asking, I still want updates at everyone until the actual go-live date actually happens. Councillor Crothers?
Thanks, Chair. No, I agree with, that's the point I was going to pick up on. One of the points, then, was that I do agree with, we should keep having the regular updates until such time as we do go live, then 6 months and annually thereafter, depending on how successful we are. But see, the local housing forum, strategic housing forum, something, it's almost like a, sounds like it's almost like a, they were organisations that were similar to the steering group you've got in place at the moment, but without members. Have we got any anticipation of bringing them back into something like that group? Because I found it very, very useful. We were able to sit down as members around the table with the RSLs and have discussions. And that's where the first time I heard about this Common Housing Register, from my perspective at that time, was through that type of forum. I found it very useful.
Thanks, Chair. Yeah, I have to apologise to members about the delay in setting up the Strategic Housing Forum. We had hoped to get them up and running again this year after the delivery of the LHS. Because of changes within our structure, mostly because of my shift across to cover welfare reform and the revenues and benefits agenda as well, the capacity has been a bit pushed to do that. But we were committing to get them up and running again next year on a quarterly basis, as previously agreed by the Housing Subcommittee. So there has been a gap there, which we acknowledge, but we'll get them up and running in the new year once we've got our capacity sorted out within the rather stretched management team that we've got at the minute.
Councillor Peacock?
Thank you, Chair. Just a question regards the sort of marketing for one of this policy through the associations to their own residents. Do we know that the various associations are going out to their own tenants and saying, look, there's a change about, this is what's going to happen, this is how it may or may not impact on yourselves? And I appreciate it's for all new allocations, but at the local TARA meeting that I was at just last week, a question was asked to the DGHP representative that was there on the policy, and he couldn't answer it. He said, it's a council-led project that's blah, 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 blah. And I said, well, actually, no, it's not. You know, it's DGHP are the lead organisation within this. So are the RSLs actually going out to their own people and explaining the whole situation, putting on roadshows or whatever it may be, just so they're all aware of what's happening, rather than when it's happening, because we're not aware of that?
Thanks, Chair. Yes, there's been quite extensive consultation. We did a postal survey, and there was some like 2,500 responses to that survey, and that was seeking views from applicants and tenants about what priorities we should be looking at in terms of developing a common allocations policy. There was a media campaign, there was press releases, and there was a series of 12 roadshows. So we have got that message out. We've also started a training programme for all the RSL staff and the operational staff within the council. That happened in September, and as we move towards the implementation and go live date, that training will be spread right across all the organisations. It may well be that that individual officer from DGHP hadn't been involved in any of the training, but there's staff newsletters have gone out, and there's certainly communications gone out, generated by the steering group, but also by individual RSLs. So that's definitely happened. There may be an occasional breakdown in communications. In terms of the detail of what would be in the policy, I think it'd be fair to say at this stage, nobody could answer that question because we're still drafting it, we're still having to test it. We can't test it until the software is completely in place, and then it needs to come back to the respective boards and the committees for sign-off. And at that point, we can start then engaging in a more detailed discussion about what the policy actually is. So we're a little way off that yet, but the drafting of the policy is well in hand as well.
If there's no further questions, we'll move to recommendations. Members are being asked to note the updated position in taking forward the Common Housing Register as summarised. Number 2, the revised position regarding the go-live date as a result of the additional software development, and to still receive regular reports on the CHR will still come to the Housing Subcommittee. Thank you. Just shows Mr O'Neill doesn't feel left out at Housing Subcommittee. He's got a verbal update for us.
Thanks, Chair. Members may or may not be aware that on the 1st of October, the Local Government and Planning Minister announced a Town Centre Housing Fund. That's basically a £2 million fund that local authorities were invited to bid into. But unfortunately, the deadline for applications was the 30th of October, and the application paperwork I don't think was issued until the week beginning the 7th of October. So right away we had a problem in that the bidding process didn't in any way align with our committee cycle. So in discussion with the chair, we agreed to go ahead and submit a bid. We thought it better to do that than not and miss out on the funding altogether. So what we've done is we've bid for £459,000 out of the £2 million. And the reason we were able to do that was because of the work that we'd been doing on the Dumfries housing regeneration area, and that we'd been working already with a lot of owners of empty properties, and we had some detail to hand, so we didn't really need to work a bid up from the beginning. So the £459,000 covers 2 flats and 2 commercial properties in Queen Street, 3 flats in Church Crescent in Queensbury Street above Bernardo's, and 2 flats and 2 commercial properties in Friars Vennel. I think members of, certainly the Dumfries members will be very familiar with the Vennel property that made its way through the planning process. So if the bid were to be successful, that would bring back into use in the town centre 7 flats and 4 commercial units. The bid is currently being evaluated by the Scottish Government. They've just come back and asked for clarification questions, and they haven't given a time frame for when there'll actually be an announcement. A relatively small amount of money, and we're asking for quite a lot of it. But we'll see how we go. What we've said to them is that if there was significant pressure on the fund, we'd be prepared to discuss any element of the bid rather than lose out. So if they thought that that was too much out of the whole pot of money available, we could look at any one of the projects in isolation and scale it down. But obviously what we'd rather do is get it all. So it's just to let members know that that's what we've done, and hopefully you'll understand why we did it, because it was really the choice of sticking in a bid or missing the deadline altogether, and we to go with the information that we had available. So we couldn't really work up a project in another part of Dumfries and Galloway because we didn't have any baseline information, we didn't have property owners, etc., etc. So it was pretty much a pragmatic response to a rather ridiculous time scale.
Councillor Smith? You won't be surprised to know that I'm delighted with the contents of the bid. And hopefully, I mean, I think it's a very tight timescale to say the least. Hopefully that will work in our advantage that we obviously had the information and the project's ready to go, whereas maybe other parts of Scotland may not. So I think asking for 25% of the pot is not a bad request. So good luck with that, and hopefully we'll get something, if not all of it.
Yeah, I would certainly echo that. It's only because of the work that's been done beforehand, which I'm enjoying the fact that they had this stuff sitting ready to go. I've got my own reasons why I think that maybe the Scottish Government actually gave such a tight timescale. Hopefully their decision will be in such a tight timescale as well. I would just like to point out that it was as caretaker chair that I was speaking to Jim and John regarding this. I was not making any presumptions. It was just the fact that there wasn't one, so I just kept on going until I was told otherwise. If there's nothing else, I have no other... Sorry, Councillor Carrs?
No problem, Chair. I mean, I think just to thank you for doing that. I think it was the right thing to do. I think it absolutely was. I think proportionality, if you divide it by 32 and about 65k we're due. So it's absolutely right that we've bid well in advance of what our allocation might be, but hopefully we'll be successful with that. And well done to everybody concerned, myself and obviously John and Jim as well.
Yeah, thanks for that. I have no other business. I declare the meeting closed. Thank you very much.